love and feel proud.
Yeah!
Of respect.
Even though we're not in person, let's just show the love.
I like that you're different from me. I think we can be friends. I want to listen to you. I hope you'll listen to me.
Our skin may be black or may be white. We might wear glasses or have good sight. We could be short or we could be tall. It really doesn't matter at all.
These are my people, these are my friends. Respect each other, that's what we said.
Like that you're different from me. I think we can be friends. I want to listen to you. I hope you'll listen to me.
We aim to follow the golden rule. Kindness and caring are just so cool.
Our smiles light up another's face. We can make the world a better place.
These are my people, these are my friends. Respect each other, that's what we said.
I like that you're different from me. I hope that we can be friends.
I want to listen to you. I hope you'll listen to me.
Awesome job, usability!
Good evening, everybody. How about that video, the Horvitz Youthability folks adapting to the pandemic? I'd like to call the 145th annual meeting of the Jewish Family Service to order. I'm using my virtual gavel and my virtual podium to officially call it to order. Pretty sure this is the first time we've ever had a virtual meeting in 145 years. We were around for the Spanish flu, but it was pointed out that Zoom probably didn't exist at that time. My name is Dan Zellman, and I'm at the beautiful Color Tone Studios in Solon, Ohio. And this background behind me is an actual background, not a virtual background. All of us, except for me right now, are masked, and we were keeping social distance from each other throughout the presentation. The only people here are some of our JFSA folks and a few of the technicians that are making this happen. We've got over 100 viewers on the Zoom right now, and the number's growing steadily, as I see. JFSA, the theme of this annual meeting is essential today and essential always. During this pandemic, JFSA has continued to provide all of the services that we provide all the time. The clientele we service, the seniors, Holocaust survivors, the developmentally disabled in our group homes have continued to need the same kind of service and maybe even more than they did during normal times. And we've just come through as you expect us to. You're going to hear a little bit later from our guest speaker, Dr. Brook from MetroHealth. MetroHealth has been an amazing partner for us during this pandemic. And then after Dr. Watts' talk, we're going to have a period for question and answers. And now it's time to do a tribute to some friends and board members that we lost during this past year. So please watch your video.
taking temperatures, making sure everyone had their masks, making sure everyone sanitized their hands, making sure my area was sanitizing, trying to keep everyone safe as well as myself.
The way we delivered service and achieving potential totally changed. Everything that we used to do was turned upside down. The change was instant and ongoing because it was really what we need to do in the moment. You know, grocery stores were empty, they couldn't go anymore. So how do we get people on a really fixed income that no longer can leave their house, making sure they have groceries? So we did food drives, we got donations, and we were passing out fresh milk and chicken to people, things that we wouldn't normally do. I mean, it was things like that, making sure that people could eat.
Traditional events just, didn't take place. We kind of moved it into these deliveries we do every single week, whether it's bagels or challah or, pecan treats or themed cookies. We try to bring anything to cheer people up, make a connection with them, either by phone. Some people wave to us through the window. Other people, chat on the phone a little bit, and some we've met out on the porch.
Good evening, everyone. It's my pleasure to bring greetings to you on behalf of the Jewish Federation of Cleveland. We are not celebrating just another normal exemplary year at JFSA because this hasn't been like any other year. Tonight is about JFSA's work being essential today and essential always. It's apropos for this unprecedented time, but we didn't need a pandemic to know this truth. JFSA's work was essential before COVID and will continue to be essential long after. As partners of JFSA, we are committed to caring for our community during the most vulnerable times in people's lives, and we work together to meet their needs. I want to personally thank JFSA's frontline staff. Your dedication to serving clients with compassion and dignity has transformed lives. You meet each challenge with intention and creativity. Today, when people are isolated and not able to be in person with family, you are their family. We've seen that programs like the Horvitz Youth Abilities Program have found new ways to spend time together virtually. Cafe Europa participants receive a weekly care package. More people are able to access dementia caregiving support and education, and telehealth counseling and support groups have all helped people maintain connection while staying safe. JFSA has always been and will continue to be essential and here for the Cleveland Jewish community. Like the Federation, JFSA is here for good. And this is why JFSA receives the largest local allocation, over $2.7 million during this current fiscal year. Goes to JFSA from our community's annual campaign for Jewish needs. I would be remiss if I didn't pause for a moment to thank everyone at this meeting for their participation as donors in our Jewish community's annual campaign. Campaign closes in just a few days on December 9th, so if you haven't already done so, thank you in advance for your gift. Our partnership with JFSA is so much more than an annual allocation. We work together to strengthen our community day after day, year after year. On behalf of the Federation, I would like to welcome tonight's guest speaker, Dr. Brook of MetroHealth, who will be talking to us about facing the challenge of COVID-19 in our community. We are grateful for your guidance and wisdom. And congratulations to New Life directors, Kent Hayes and John Wirtschafter. Thank you for your steadfast commitment to JFSA. I want to give a tremendous thank you to CEO Susie Bixel and Board Chair Dan Zellman for their leadership every day, and especially today during this pandemic. Their leadership has really been exemplary, and I know that we all depend on them. So thank you both very much. Thank you to all of the volunteers, donors, and those of you who devote your time and energy and work to ensuring that our community members are never alone in their time of need. Congratulations on all that you have accomplished this year, and may we all go from strength to strength.
it was a huge worry that the people that we work with would be trapped in the house with the people that are hurting them, the perpetrators.
My wife has lung diseases. She has asthma. She also has some lung infections that they're trying to get rid of. And my main concern was interacting with people, even though they had masks on, they practiced social distancing, the fear that when I came home, I might give her some of the viruses, even though I myself didn't have them or didn't contact them.
The clients, you know, they come to us with so many needs and so many abilities, and we are able to draw out, you know, all the things that they're really good at, and not being able to see them with consistency just, you know, frightens me that they're going to get sad and they're going to get lonely and they're going to get depressed and they're going to take risks that you know, put them in the line of the virus.
Good evening. I am Sue Ellen Cadis, Chair of the Leadership Committee. As Chair, I have the honor of working with the leadership of JFSA to ensure we continue to build a strong and effective board. Through challenging times, the board is here to support the professional staff. This year, we are all so proud of how JFSA has responded, that despite COVID-19, our clients and their families continue to have quality care from a truly dedicated staff. I want to thank 4 retiring board members. Each has served the agency in many ways, giving of their time, talent, and treasure. Carol Berg is completing her second 3-year term. John Herman his 3rd. Sherry Lynn Lehman and Robert Schwartz have completed 5 terms. Many thanks to each of you who have helped to make JFSA strong. In an effort to streamline tonight's annual meeting, the Board of Directors has already approved the following term renewals and election of new life directors. Sandy Goldman is returning for her 3rd 3-year term. Larry Rothstein and John Wise return for their 4th terms. Ethan Cohen for a 5th term, and Sherry Perlmutter for a 6th term. Congratulations and thank you for your dedication. Our representative directors from Akron each serve a 1-year term. Diane Newman was elected to serve a 2nd term, and Richard Zellen was elected for his 3rd term. In addition, we have welcomed 2 new board members that were elected in the last year. Chad Zimmerman joined the board in July, and Mike Cole rejoined the board in October. Thank you for your commitment to JFSA. I am also happy to announce the election of 2 life directors, Ken Hayes and John Wertschafter. Ken Hayes joined the JFSA board in 2011, when JFSA and Plan of Northeast Ohio merged. Since then, Ken has served as chair of the Plan annual campaign, which raises approximately $60,000 each year, always surpassing the campaign goal. Kent was critical to the development of the Plan endowment, which currently sits at just over $2 million. Kent also serves on the board of JFSA's Center for Cognition and Recovery. John Wertschafter joined the JFSA board in 2001. He has served on many committees during his tenure and led the Human Resources Committee for 14 years. John has focused his efforts on the long-term health of the agency, whether it is through effective negotiations with the union or with our healthcare insurance brokers. At the same time, he's a tireless advocate for our staff, ensuring the agency is able to maximize our employee benefits. Congratulations to these well-deserving leaders. Finally, congratulations to the 2020-2021 slate of officers as presented in this slide. We look forward to a challenging and exciting new year. That concludes the leadership report. Thank you so much.
It's amazing to me how in 30 seconds of an engagement, how much impact it has on those clients.
You know, at first you think you're going to be just dropping off a meal with somebody very quickly, and before you know it, you become attached to these people, and you know, you worry about them. I look forward to seeing them. If Mike and I had a week where we couldn't do it, all of a sudden I'm starting to worry. Well, I got to make sure I'm back the next week. It's not just a duty or a chore. It becomes, very personal, and you worry about them.
We do see declines, that mobility, like so many people that were walking and, going to shul, let's say, or they can barely walk. They're cognitively, they're not talking to people. So there is a decline. That's very sad to me.
I am really surprised and impressed how well JFSA has operated. And I mean that we have not missed a beat. We have not had service disruptions. We have had staff really so willing to do whatever it takes. And people have been doing all kinds of jobs that aren't their normal job. We joked about all other duties as assigned is kind of a logo for what's been happening.
Despite the fear of COVID-19, the unknown of COVID-19, losing family members, losing co-workers, they're still stepping up to that plate to hit that home run to take care of these individuals, because this is what we do.
Good evening, everyone. I'm Michelle Hirsch, and along with Dee Kleinman, we are the co-chairs of the JFSA Volunteer Services and Engagement Committee. Our JFSA volunteers have been a critical element in our efforts at caring for and keeping clients connected despite the challenges this pandemic brings. Our home-delivered meals, drivers, many of whom are volunteers, have shown great commitment and dedication to keep clients healthy and safe at home. We are grateful for their volunteer service, especially during these uncertain times. Tonight, we have the pleasure of recognizing 3 special physicians who volunteer their professional time at Allison's Place Medical Clinic in addition to their regular practices. Ophthalmologist Dr. Philip Goldberg already sees many of our residential clients in his Cleveland Clinic office. He volunteers once a month in the clinic with ophthalmology equipment donated by the Cleveland Clinic. Since facial masks are mandatory, examining patients with fogging equipment and glasses can be challenging, but Dr. Goldberg makes it work. Dr. Singerman, a podiatrist, also volunteers once a month. To protect his patients and himself during the pandemic, he hangs a clear shower curtain over the exam table so that he can still see his clients and make them feel comfortable. Dr. Grossman, who works at Allison's Place Medical Director 4 days a week, also volunteers his professional time. He trained JFSA's nursing staff on how to conduct COVID testing. He even let our nursing staff practice performing nose swabs on him. He also volunteers as a lecturer in JFSA's Healthy Brain and Wellness Speaker Series. Each of these doctors show great personal commitment to our clients, especially during the uncertainty of the pandemic and the health risks they themselves face when caring for our clients. As we approach the colder months and as COVID cases rise, we are especially grateful for their unwavering commitment to our clients and the extraordinary care that they provide. Thank you for all that you do for JFSA.
Had talked a couple weeks ago with my client, and she said, Oksana, only you are interesting about my life. Nobody calls me, even I have a lot of services from other companies, and it's kind of strange that nobody cares. But Jewish Family Services do their best job, and they worry about people.
In the global way of the Holocaust, we should never forget what happened to people because we don't want history to repeat itself. But more and more now, my clients who are elderly, I'm hearing them say, don't forget me. I suffered so much and I'm here for a reason, and I want you to remember me.
We still had staff in rare instances that had to take clients to hospitals because of urgent appointments. And I think it's things like that we didn't hesitate that really set JFSA aside from everyone else.
I'm learning more and more every day about the good things that JFSA does, not only for the Jewish community, but for everyone we're here for.
Good evening. I'm Susie Bixel, President and CEO of JFSA. Before we get started in this portion of this evening, I want to take a minute and thank our women behind the curtain this evening. Ann Rosenberg and her staff, Casey, have pulled off what might be the most unique annual meeting of our agency's history, and I want to give a heartfelt thanks to both of them this evening. It is my great pleasure tonight to introduce our guest speaker, Dr. Brook Watts. Dr. Watts is the Vice President and Chief Quality Officer at MetroHealth Hospital. Dr. Watts attended University of Alabama Medical School and completed her residency at University of Michigan. She has also earned a master's in health policy at Case Western. Brook is board certified in internal medicine and also board certified by the Board of Preventative Medicine in clinical informatics. Dr. Watts has been JFSA's lifeline during this pandemic. The number that we call for guidance and assistance at every turn, trying to navigate through the COVID storm. She has been responsive. She intuitively knows what we urgently need and why, and she does her level best to get us what we need quickly, whether it's access to testing or results for testing that's already been done. Dr. Watts understands that we are serving the community's most vulnerable, and we have known from the start of working with her that she is as committed as we are to keeping the people we serve and those who serve them as safe as possible. I was talking with one of our staff this afternoon before coming here, and she turned and looked at me and said, "What on earth would we have done this past 6 months if we hadn't had Dr. Watts?" And I'm so thankful we don't have to answer that question. This evening, we will be taking questions for Dr. Watts, from Dr. Watts, or for Dr. Watts. In your Zoom control at the bottom of your screen, you will be able to submit questions directly using the Q&A button. Just type your question, and she will answer as many as we can this evening. Remember to be brief, since questions will need to be read out loud. And now to Dr. Watts.
Thank you so much, Susie. It means a lot to hear your words. It's been a great joy for me to be able to be of service to you. For all of you out there, I can tell you that in my 20 years of being a physician, I've seen more suffering in the last 9 months than I've ever seen. But despite that, there's been tremendous joy and tremendous blessings. And so not sure what you think the next 10 minutes are going to be about, but for me, it's going to be about sharing those joy and blessings that I've learned over this short period of time. So how did this community work get started? Well, I was in my office back in late March, early April. We started our hospital incident command at MetroHealth, and I was one of the medical officers that was working on the response. And one part of that was community work. I got a phone call from a group home that I'd never heard of, not JFSA, another group. And this woman who called me said, I just started as the nurse manager and the director of this nursing home a month ago. And I just learned in my training wheels, and this COVID thing's happened, and I've got a positive staff member, and I have residents that I think are sick. What do I do? And if you remember, this is back in March and April, we weren't really even sure what we were supposed to do about masking yet. We barely had testing access. There wasn't a whole lot of guidance out there. The answer was, honestly, I wasn't sure what we needed to do, but we knew we had to do something, right? We couldn't leave her there. We couldn't leave those folks there. So I went to my boss, who's a very wise man. I think he's spoken with many of you, may have seen him speak before, Dr. Akram Boutros, the CEO of MetroHealth. And I said, Akram, here's the situation. What do I do? And he gave a very acrim response, which was do the right thing. And he said it in that acrim way, which is not only are you going to do the right thing, but you're going to do it right now because I'm going to check with you tomorrow and you better have done it. So lo and behold, I gathered up a team of 4 nurses from the emergency department. I figured that was a good start because I had no idea where we were going or what we were going to do when we got there. So ED nurses are good for that. And we gathered up a team. I gathered up another physician friend that's done some community work. We climbed in the van. I was driving my minivan. We had a bunch of boxes of supplies. We did have testing supplies. We had PPE. And we drove out to a Cleveland suburb. And for many of you who will appreciate this, who've been to group homes, it was one of those situations where you pulled up to a lovely ranch home in a suburban neighborhood that, for all intents and purposes, looked like any other home. The only, giveaway was that there's a larger than you would expect parking lot in front, right? And we pulled up and this parking lot was overflowing. And in fact, there were cars parked going down the driveway of this ranch home in this suburban neighborhood. And what had happened was that the nurse leader had called her staff, and the staff is home 24/7, and told them we were coming and if they wanted to get tested that they could come. And they were all afraid and not sure what to do or to go into their homes, so they were all parked in their cars, each individually in the parking lot and down the driveway, just waiting for us to show up. So thank goodness for emergency department nurses. We gathered on our PPE, we got the test kits out, we sort of made it up as we went, we figured out a plan and we tested all those folks in their cars in the parking lot. I won't ever forget that first testing day because about 15 minutes into the testing, it started hailing on us and coming down, the wind's blowing, and the nurses are testing. So we got that part done. And the next part was we moved into the actual house. And I think what struck me right away, I walked in the door of the house and it was clear there was a young man with autism who ran right by me. And he had a path to run around in circles in the house. And it was wonderfully set up so that he could sort of get that energy out and make that movement in his environment. And right behind him was another young man who was a worker at the house who was trying to wear a mask. The resident, would have struggled to wear a mask. And it was his job to chase this young man around and make sure he didn't get any trouble during his lap. And it was such a striking experience because it showed me that in many of these situations that are congregate living environments, the things that we take for granted, being able to do social distancing, being able to wear masks, or perhaps when we go home to be in a safe environment where we feel comfortable not doing those things, weren't possible in this environment. And I think what also struck me there was how incredibly hard the staff of this home was working to keep their residents safe and themselves safe. And as we went through that moment and we were able to provide testing, I had an incredible moment of clarity that these really were the most vulnerable among us, and that it's our job or our place, and certainly for those of us who feel mission driven and have the privilege to work at MetroHealth, to try to provide and support those folks. So that was our first testing experience. And the great news, I guess, from that was when Susie and JFSA called me the first time a few weeks later, I had experience under my belt and we knew what we needed to do and how we could help. We were able, with the support of our CEO, Dr. Akram Boutros, and the Cuyahoga County Board of Health, which has been a tremendous resource to all of us in this community during this time, to put in place programs to support community testing. Over the last 8 to 9 months, we have been able to go out in all kinds of environments, I have a much more trained testing team now. We go out to shelters on a regular basis. So for example, this week alone, we're at 6 different homeless shelters providing testing. We work with Homes for the Developmentally Disabled. We're doing outbreak testing this week. If we need it, if we could, we'd do outbreak testing every single day. There's a tremendous need. We've also worked with faith-based groups to provide testings in safe places like church parking lots or for other religious groups during this time. I think one of my most treasured memories from this time will actually be related to testing in the observant Jewish population. Some of you may be aware, but we've been able to support several large testing events in the Cleveland Heights area for the observant Jewish population. And my team, right before the first event, with good intentions, contacted our inclusion and diversity folks to make sure that they understood and knew what to expect in working with an observant Jewish population, which I thought was a great move, but also learning. And so I asked the nurse leader when she got back, how did it go? And she said, wow, the rabbi's son showed up with a boombox for music and they brought us Starbucks. So I think it was, I'm not sure exactly what they expected, but it ended up being a really joyous experience. We have, with MetroHealth, also worked very hard to provide community support to encourage people to stay at home. We have our COVID hotline, which is a 24/7 hotline that allows for televisits with physicians, nurse triage, and televisits with physicians. And we've used that to help encourage people and give them direction on where to be tested and when to be tested, and also when to stay home. We fielded thousands of calls that way, which I think has really provided a critical support to folks to keep them out of the community and out of doctors' offices when they can, so that they are safe and the community is safe. The other part of that hotline is it identifies social resources for folks that need them. We can have a social worker call you the next day and connect you with resources through our Institute for Hope, which is an incredible group that provides all kinds of links to social services and protections in the home. And the example is they've been very vigorously dropping off diapers for new moms and others with little kiddos that may need diapers but can't necessarily go out. So I think hopefully what you got in a sense of is that this is truthfully been a very challenging time, but I think in every moment I've seen people among us rise to the occasion. And I think what I worry about the most going forward, especially over this next month or so, you know, I truly believe we're entering a very dark time. And really probably, I hope, the darkest time of this pandemic for our country. But this isn't a sad thing, right? There is light, there is hope, and it struck me that we are coming, you know, time for Festival of Lights, right? I think we might need it more than ever this year. I think for all of us that can and will, this is a time for light, hope. This is a time to relieve suffering for those around us. And the reality is that all of us every day have the ability to relieve suffering, right? We can lift up those around us. We can relieve suffering by protecting the most vulnerable among us. Right now, this means wearing masks. This means social distancing. It means staying home. That does not mean we lose the responsibility to lift up our community, right? We can do this. This is a time, at least for me, to think about how we are judged. We are judged by how we protect the most vulnerable among us. For me to be able to be, over the last few months, to help organizations like JFSA, and I hope you know how good you've done and how hard your staff has worked and how truly grateful I am for your partnership and for the work you do on behalf of the community. But we are judged by how we treat them and care for the most vulnerable among us. And I think we have an incredible opportunity, especially during this time in the next month, to really show what that means. And that's a blessing. I feel it, and I hope you feel it as well. It is, again, such a privilege and an honor for me to be here today and to be sharing this time with you. And as I understand it, I am to stop talking, and I hear we're going to have some questions. So thank you for your time, and let's see what you want to hear about.
Thank you very much, Dr. Watts. We appreciate those heartfelt remarks. As Susie mentioned, you have been an amazing partner, you and the team at MetroHealth, and I don't know where we'd be without you during this. So really just thank you for doing this tonight, and thank you for all that you've done for Jewish Family Service during this period. So we have several questions that have come in, and they center around the vaccine. So the first one talks about the vaccine and mask wearing. So can people stop wearing masks the day they get the vaccine, or is it a longer time period? And then once people get the vaccine, is it a free reign to go where they want to and do what they want to do at that point? Or so how do you see this all playing out over the next few months?
Well, that is a perfect question to start with. So I'm very much an optimist, and I do feel very good about where we are with the vaccine, and I think we're going to continue to hear good news about the vaccine and progress. But unfortunately, it does not mean a free pass. And my ask, and I think the recommendation that you will hear more widely, is that we all need to keep wearing masks. And we're going to need to keep wearing masks for quite a while. For me, the vaccine or getting the vaccine is not a path not to wear a mask. And there's many reasons for that. But the most important one is that what we are doing by becoming vaccinated, and moving forward within our community is trying again to protect the most vulnerable among us. And I think that the mask wearing itself is going to be a part of that for a long time. Another reminder to folks is that the vaccines that are coming out and we should start to see soon are all 2-dose vaccines, which means you have to have a dose, and then you have to wait a few weeks, and then you have to have another dose. And immunity and, your protection comes sometime after that. So, this is not going to be something where you think you get one shot and then you're free and clear and you can do, take whatever risks you want to for your community. We're going to need you to wear masks, and we're going to need you to think very responsibly for quite a while now. Okay?
Thank you. Another one related to the vaccine is in terms of how it's going to be distributed. There's articles that are coming out every day, and a little more information is known every day on the priority system. And then also which vaccine, because right now, 2 companies, I think Moderna and Pfizer, have both gone for the FDA approval. And how are we going to know, once there are more than one vaccine approved, which one should we go for? Should we hold out for one versus the other? So what do you think about those?
Sure. So we are still, we're very excited. As we all know, that the FDA is going to take a good look at these later this week. And they go through, and it's important. I know everyone probably saw that the UK had approved the Pfizer vaccine this week. It is very important that we go through the process with the FDA that they go through. This is a very standard process for them to evaluate the data and tell us how things look. And there's particular pieces of the data that we have not seen publicly yet that will be part of the evaluation process. So we want, this reminds me a little bit sometimes when we are waiting for results from a test. For example, if we've done a biopsy for cancer, and people, they want to know, and I know they want to know, and they want to know now. What I always say is, we'd rather they get it right the first time. And so we got to wait. We'd rather they get it right. And that's how I feel about this FDA process. I trust the process, and the fact that they've said they're going to do it with diligence in the same way they always do it, that is good for us. That is a good sign, and that means they're going to look at the data carefully. I can tell you from what I've seen so far, and that's been released, if it was up to me, if you could give me both of them right now, I wouldn't pick. I'd take whichever one I could get, because this is going to be about getting arms on a vaccine more so than any of the other concerns. But I think we'll all learn more as that FDA process goes forward. And again, I think we should all be really proud that it's going forward in the right way with all the due cautions to get us there.
Great. We had one from one of our 88-year-old clients who says that she lives by herself, and when do you think that she will be able to get the vaccine? And she knows how to use Zoom.
Well, right there you get points.
Right.
You know, it's a good question. I think, you know, and again, it's all speculative. None of us have hands-on vaccine yet, right? We are hearing, you know, that we should, if the process goes forward as we all hope it will, and there's no surprises and the data review is complete, that the vaccine doses already exist and they will start going out. And as that happens, you know, which we hope, you know, within the state of Ohio, we've heard tentatively, I'm sure we've all heard within the next couple of weeks. And then the hospitals will start, and there's a couple of core hospitals that are getting the first doses. MetroHealth is one of them, the Cleveland Clinic is the other. In our region, we will be giving them out first to the priority groups, which include healthcare workers. The definition of healthcare workers includes both folks in the hospital, as well as healthcare workers in nursing homes and nursing home residents. And the truth is, you know, the reason to do that is that that's where we've seen the greatest burden and the most suffering, most death. So, you know, that's about as far as we really can understand and think in terms of the distribution to this point, if I'm very honest. And you know, again, I think optimistically we're going to continue to hear good news and that more volumes would be coming. So I would hope very much for an 88-year-old who uses Zoom that we'd be looking probably in early spring that there may be wider availability, but really truthfully that's a guess.
Okay, thank you. What do we know about side effects right now? And is it going to get you sick for a little while? Are you going to be sore? Are you going to feel under the weather? I mean, I haven't read much about that, and I've got a couple questions here asking about it.
Yeah, and I apologize if you hear my dog there.
Oh,
I closed the bedroom door, and she's decided it's her bedtime because it's past 8 o'clock. She's an old dog, and she doesn't stay up very late. But the question about side effects is important. We are hearing that for some of the, you know, there are some potential side effects. People may feel under the weather. You know, this is something we know does happen sometimes with vaccines. And, you know, the way we think about it with something like the flu, for example, is we're actually not so sad on the medical side. If you feel a little under the weather when you get the vaccine, that usually means to us that you're having a vigorous immune response to it. So, so when people say, oh, my arm hurt, or, you know, I didn't feel very good after I got that flu shot, and we say, that's a great sign. You know, that means your immune system is working. It's making all those important things that your body needs to fight off the virus if you to get it, you know, when it does come. So I think we are expecting some side effects. There's nothing I've seen, at least in my readings so far, that are scary to me or things that would make me, you know, afraid of doing it. It is a scenario where we've talked about we probably wouldn't want to just go on to a particular unit like, you know, an ICU and just go, guess what, we're going to do all the nurses today and have everybody feel under the weather at the same time. That's probably not the best approach. But again, everything we've heard so far is really within the context of how we think about these things in other ways and things that we consider to be safe. Does that help?
Yes, thank you. We'll do a couple more. One of them is we've got a few snowbirds that have asked questions about, first of all, about going wherever they go south, and then secondly, if they go and it's their turn to get the vaccine, let's say that happens in March or April, do you think they'll have to come back in order to get the vaccine because it's on a state-by-state basis as opposed to where you might have a winter home?
You know, that's a great question. You know, I am not sure. It's going to, and here's what. what strikes me is, and I might have said this already, but if you get one vaccine, so you get, for example, the Moderna vaccine, one dose, your second dose has to be of that same vaccine. And so it makes the most sense to me, as for advice, is that if you begin that vaccine process, that you want to plan to be in the same place so that you can get both doses. And one of them is within 21 days and the other is within 28 days. So you're talking about a month roughly for both of them. But I think that the safest thing is going to be able to be in the same place to make sure that the healthcare providers in your area or that you're receiving from are able to get you the right vaccine at the right time.
Great. Okay, we'll do two more. One of them, if someone tests positive for COVID, when can they get retested, and should they get retested?
Yes, and this is a very good question. There's been a lot of changing guidance around this piece. For the most part, there was some original guidance I was probably referring to is, wanting to have a couple of negative tests before we sent people back to work in an environment.
One more.
Now we really work on thinking about infectivity and what we know about isolation. So the CDC guidance right now is not, for the most part, not a test-based guidance. It's really about saying, okay, from the date of your positive test, you are in isolation for 10 days. And, that means staying home. That means in a different bedroom, in a different bathroom if you can. That means masking if you're in any public areas or common areas of your house, and generally just staying away from folks. It means learning how to use Zoom and really trying to protect your environment and family by staying in isolation. We don't routinely use, the vast majority of clinical settings and other settings, a follow-up test after is really not felt to be very beneficial, to be recommended or beneficial. It's really about those 10 days of isolation.
Okay, thank you. Last question. Talk about rapid testing, because we've heard stories, all of us have, of people having to go to the drugstore that's in 4 cities away, or go to a branch of one of the hospital systems to get tested. And we keep hearing about the availability of rapid tests or at-home tests that are accurate. So what do you know about those, and how close are we to getting something where all of us can have a few of the swabs in our house and do it ourselves and know within some reasonable time frame if we have the virus or not?
Again, I tend to be a very optimistic person. I really believe on what we've seen so far in this pandemic is this technology is continuing to evolve and it's continuing to get better and better. So rapid antigen testing, which is what most of these rapid platforms are, and I just, not to get too technical, and I honestly these days most people know these bits and pieces anyway, but there's 2 kinds of testing. There's the PCR testing that's looking for actual genetic material, and then there's the rapid antigen testing. Most of the rapid testing that you're seeing right now that's for home is the antigen testing. And it isn't quite, it's never going to be, in my mind, quite as good as the PCR testing. It's just kind of the way it works. But there's also potentially very important information that can be gained from that test, especially now that we understand and we tolerate a little bit better the fact that there may be things like false positives, right? We all know the example of the governor. So the governor was tested with a rapid antigen test and had a false positive as a result of that. So those platforms already exist. Many of us are already using them. I've been in good conversations with JFSA about those platforms. We are also beginning to use them in community settings where we can help with outbreaks. Understanding that they're always going to need a backup test with PCR. But I think what I expect is that you will see more and more of these rapid testing platforms. You'll see more and more of them used also in community settings and healthcare. In fact, the CDC released new guidance on Monday that really encourages basically testing anybody, anytime, any way we can. And I hope and see that as things move forward, as we start to get into March and April, you really start to see evolution of the technology in a way that makes it more cost efficient and affordable and available for more of us. I must tell you, there's one particular test on the market that we've used that we are calling the pregnancy test. It's looks just like a pregnancy test, but it happens to be for COVID. So I think we're going to see things like that, they might not be the gold standard, but they can at least help us in managing community management going forward.
Thank you very much. We appreciate you taking the time tonight. We appreciate your partnership. And you would have received this great round of applause if we were doing this live. So instead of saying next year in Israel, we're going to say next year at Executive Caterers, so that we can have a real meeting and invite you as a guest and recognize you for all these efforts that you've put forth, because it's been, as Susie mentioned, so helpful to JFSA, and we appreciate everything that you're doing and continue to do for us. So
my privilege. Next year in person.
Thank you. Okay, just a few final remarks. Thank everybody for hanging in there with us. First, I want to echo congratulations to John Wirtschafter and Kent Hayes for becoming life directors. As the video said, you guys have both been so important to JFSA for a long time, and congratulations on this appointment. Also, thank you to the retiring board members and to the existing board. We have had many, many virtual meetings over these last months, and we'll be continuing to do that for the next several months at least. And we've had great attendance, great input from our board, and it isn't working the way we thought it was going to, and everybody signed up for it. But everybody's been very diligent at being part of what we're doing and part of what we're helping to do for the community. Also, to our staff, we have 700 or so employees at JFSA, and it has not been easy to service all the clients that we have continued to service throughout this whole period. We have had certain people who couldn't work for various reasons. We've had certain people that work for us that are elderly that we're concerned about going into work. We've had mostly a daily scramble to make sure that we are servicing the clients we need. And our staff has done just such an amazing job making sure that everybody we service has the people they need when they need them, and that there's been no drop-off at all. So really a big thank you to Susie and all the JFSA staff that have continued to just do unbelievable things during this period. Next, to the volunteers. We've had many volunteers, Meals on Wheels delivers, people who do visits to the elderly in their homes, who have stepped up during this period. We couldn't have survived through this without you. And really just thank you to all the volunteers that have provided services during this period and will continue to do so. Thank you to all the staff people who were in the videos that you saw before this. And we appreciate you taking the time to do this and for sharing your feelings about JFSA. And then thank you, Erica, for the Federation greetings. As Erica mentioned, the Federation campaign ends in just a few days. And if you haven't done your 2021 donation yet, please do so. The community is counting on you for the revenue that we need and the donations we need to keep JFSA and all the other agencies afloat. So again, thank you all for joining us. We appreciate you spending the time. And like I said before, hopefully next year we'll do one of these live and have everybody in attendance. Thanks and have a good evening.
If you ever find yourself stuck in the middle of the sea, I'll sail the world to find you. If you ever find yourself lost in the dark and you can't see, I'll be the light to guide you. Find out what we're